As far as the anatomy, 3 main bones to worry about: the humerus, the scapula, and the clavicle. The shoulder has 4 joints: glenohumeral joint, acromioclavicular joint, and then the sternoclavicular joint, as well as the often forgotten, but the scapulothoracic. Thankfully, you don't have to worry about that too much. As far as the joint has the greatest range of motion of any joint in the human body. There's no inherent bony stability whatsoever, so it relies on soft tissue for dynamic or static stability. The bone stock overall for the glenoid is fairly minimal, at least in relation to the ball, especially if you consider other joints such as the hip. Shoulder anatomy can be quite complex. Obviously, we're not going over this slide at all, but just something to be aware of. As far as the indications for shoulder replacement or arthroplasty, number 1 is going to be osteoarthritis. That's the main one that people are going to think about. Also, the inflammatory arthropathies, avascular necrosis or osteonecrosis, fractures, other kinds of arthritis such as post-traumatic arthritis or tumor, and then a little bit newer one, at least in relation to the other ones that we talk about, which is the rotator cuff tear arthropathy. Shoulder pain, we all, for the most part, know how that presents. Pain could be an ache, a lot of crepitus, can be severe pain with daily activities, loss of range of motion, especially if you get large osteophytes that are becoming a mechanical block. Sometimes there could be a history of trauma or dislocations or other prior surgeries. As far as the workup, history and physical, that's an obvious one. X-rays, you want to get an AP. You also want to get a true AP or a Grashy view or Gracie view and an axillary view. So those 3 are the main ones that I get. CT scan sometimes is good, especially if you're going to be looking for glenoid version. Glenoid bone stock also can be assessed with the CT scan, especially if you get some 3D recons. MRI could be very helpful because we can also assess the status of the rotator cuff.